As a replacement for the Affordable Care Act takes shape in Congress, we're starting to hear about winners and losers. Some individuals and families would have access to better and more affordable care, but a policy brief put out by the Fenway Institute at Fenway Health warns about losses for the LGBTQ population, especially people living with HIV and people of color. To tell us about the brief is our guest from the Institute, the Director of Health Policy Research, Sean Cahill. Thank you very much for being with us, Sean.
Thank you, Chris.
First of all, I guess we have to really look at the most vulnerable population here, and that is people who have HIV. What's going to be going on with them?
Right. Well, before the Affordable Care Act, it was very difficult for people with HIV to get health insurance. And that's true of people with all kinds of chronic diseases like diabetes or cancer, any kind of pre-existing health condition. The Affordable Care Act got rid of that, prevented that discrimination from occurring going forward. While on the one hand, that provision of the Affordable Care Act will be protected under the Ryan plan that's currently before the House of Representatives, what they're proposing to do to Medicaid will disproportionately hurt people with HIV. We know that the percentage of people with HIV in the U.S. on Medicaid went from 36% before the Affordable Care Act to 42%. That's about a 6% increase in Medicaid coverage for this population. The proposed bill would basically end the Medicaid expansion and move to a per capita cap system, which will mean less money to pay for the healthcare needs of people. And it'll also cause people who go out of Medicaid, say they take a job that has employer insurance and then they have to go back on Medicaid, they will not be eligible for the expanded eligibility, which is currently in place in Massachusetts and 30 other states.
Well, within the groups you're talking about, I see two kinds of populations. I want to start with the really high risk, and that is people who might be using intravenous drugs.
Right.
And what's going to happen with them? Because we've seen an experience in Indiana not too long ago with something like this.
Yeah, there was an outbreak of HIV in southern county of Indiana, right along the border with Kentucky and Ohio. And that was related to injection drug use. And unfortunately, there was one bad thing and one good thing that happened right before that outbreak. The bad thing was that the state of Indiana defunded Planned Parenthood, and Planned Parenthood had the one clinic in this county where they could screen HIV for free, so people could go in and get a free HIV test. And the legislature and the governor of Indiana, who's now the vice president, Mike Pence, they defunded Planned Parenthood in 2013. But also that year, they expanded Medicaid eligibility in their state. So the good news is that when this outbreak happened, people were able to get preventive screenings fully covered as per the Affordable Care Act. And so they were able to get screened and diagnosed and into treatment. And that allowed the state of Indiana to really stop that outbreak from spreading.
Well, what's the importance of Planned Parenthood for the LGBTQ community? Because we do have lots of health centers in Boston, including yours. So why is it such a big deal?
So it's important for low-income people in general, Planned Parenthood. In the United States, low-income people are disproportionately Black and Latino. So that's one reason why it's important. But it's also important because actually, contrary to maybe what most people would think, young women who are lesbian or bisexual are actually more likely to have an unwanted pregnancy than young heterosexual women. So that's very important, so that women can go get the reproductive health care that they need, the sexual and reproductive health care they need. Another concern that we see in both the lesbian community and the Black and Latino women's community, so mostly straight Black and Latino women, is lower rates of mammograms and lower rates of Pap tests. So it's really important that women get these cancer screenings so they can get, diagnosed early and treated, and they'll have better treatment outcomes. And a lot of women rely on, particularly low-income women, rely on Planned Parenthood for mammograms and Pap tests.
This has been on news. We're talking with Sean Cahill from the Fenway Institute. And of course, it's not about any difference in the incidence of, let's say, breast cancer, but the mortality rate. There's a huge racial disparity that we're talking about.
Right. Yeah, there is. There's a big racial disparity. And that's another important point about the Affordable Care Act. We have big racial ethnic disparities in our country, particularly affecting Black Americans. Higher rates of diabetes, higher rates of obesity, lower rates of mammograms and Pap tests. And so the Affordable Care Act has really taken big steps toward addressing those disparities, because we know that the percentage of Black Americans who lacked insurance prior to the ACA was 19%. It's been cut to 11% of the Black population now that lacks health insurance. So that's a 42% drop from 19 to 11%, a very welcome gain. And over time, that's going to allow lots more Black Americans to access health care and hopefully get the preventive screenings that can reduce the disparities we currently see in that population.
And I want to ask you about maybe the larger part of the LGBTQ community, because I'm picturing, let's say, maybe a lot of young, healthy adults with actually a pretty good mindset about avoiding risk. What do they have to worry about?
Well, I think what they have to worry about, and what all Americans have to worry about, is the viability of our health insurance system. Without the individual mandate and the employer mandate, which requires companies with 50 employees or more to offer health insurance coverage to their employees, and the individual mandate, which requires us all to purchase insurance or else pay a fine, without that, I really think that the insurance system is not going to work. Because if you only have older and sick people going in to get insurance coverage, it's not going to be the companies are not going to be able to make it work. It's not going to be profitable for them, and insurance will not be affordable for all of us. So I think that's the major threat.
Another thing, talk about this, because you might have somebody who is not really disposed to being very risky in their behavior generally, but
Right.
I also have a sense that unless you see a doctor every so often or some kind of provider, you might not bother with getting screening.
Right. Yeah, I mean, it's true that younger people are less likely to have different kinds of comorbidities, and that your health issues tend to increase with age. But that's not to say that young people can't get life-threatening illnesses. So it's really important that even if you're in your 20s and you feel invincible, you should be going to get a physical on a regular basis and get screened for different things. And depending on who you are, there's certain, like I said, racial ethnic disparities. There are certain disparities like HIV that disproportionately affect gay and bisexual men and transgender women. So you should be screened for certain things, depending on what factors you are at play.
One other context is that no matter how much money this new plan might save the government, if we have any kind of increase in some kind of health problem and people don't have the money to pay for it, or they don't have insurance,
Right.
Who pays for it?
Well, we all end up paying for it in the end, Chris. So the Congressional Budget Office predicts that 14 million people will lose insurance next year if the Ryan plan goes into effect. The Republican plan, really, it's really Ryan, McConnell, and Trump who devised it. And over the next decade, 26 million people will lose insurance who currently have insurance. And what that means is that a lot of those people, when they have some health emergency, they're going to go to the emergency room. They're not going to get preventive screenings. They're not going to see a doctor on a regular basis and get preventive routine care. They're going to get emergency care, which is much more expensive. And even though the federal government will not necessarily be paying for that, the insurance companies are going to pay, the hospitals are going to pay, the healthcare system is going to pay. And what that means is that our rates are going to go up.
Thank you very much for being with us. And Sean, just before we break off, if people want some more information, you've got a website for Fenway Health there?
Yeah, we have two websites, fenwayhealth.org and fenwayinstitute.org. But if you Google Fenway Institute Health Policy, you'll be brought to a page which has the issue brief that we put out Friday on this topic and many other issue briefs on LGBT health and HIV that might be of interest.
Thank you very much.
Thank you.
Sean Cahill from the Fenway Institute.